Welcome, doctor. So in the beginning of the pandemic, we didn't see many kids getting sick from COVID-19. They seem to be less susceptible. What's contributing to this increase in kids going to the hospital for COVID-19?
So the increase is because the kids are not vaccinated. In New York City, the age 5 to 11 age group, 100% of them were unvaccinated, of the children who ended up in the hospital. That's the biggest contributor.
So we know how keeping schools closed negatively impacted learning and mental health last year. So how would you advise school districts in the new year, given what we know right now?
A proponent of closing. I do not think it prevents the spread. Actually, we saw last year when schools were closed and kids socialized outside of schools, they had a higher risk of catching COVID. So I think schools should be open. I really agree with Dr. Paramount. She's our chairperson at Cornell. Good hand washing, face masks, social distancing, masks, and keeping the kids in school is actually much safer than keeping the kids out of school. The ramifications of being home taught and online learning are so brutal for children. The social isolation, the not learning, the lack of socialization. I do not want to go backwards. I want to go forwards. We need these kids vaccinated.
As we reported, the CDC is changing its isolation guidance for people infected with COVID-19. If you're not showing symptoms, you can only isolate for 5 days now instead of 10. Former CDC Director Dr. Tom Frieden was on CBS Mornings earlier, and they asked him what prompted the agency to make this move. I want to play you what he said.
The virus is adapting. Omicron is different, very different from prior strains, and we need to adapt too. So appropriately, the CDC is adapting their guidance for the current situation. They're doing so in real time. We wish we knew more. We wish we knew how severe Omicron is going to be, but we won't know that for a few weeks.
Dr. Hes, do these changes in guidance make sense to you?
Yes. I have to say it's so sad that it came after the Christmas break or in the middle of the Christmas break, because I felt that many of my patients who I had to quarantine or isolate, they were very, very upset about missing the holiday, and they were feeling better and they didn't have symptoms. Many of the parents who completely tested positive, and they were begging to go to Christmas and they were begging to celebrate with their families. And I would say, I know you're 6 days into quarantine, but you still have to stay 10 days. I don't know that I agree with it, but that's what the CDC guidance is. And I said to them, I promise you that in 1 to 2 weeks, these rules will be changed because Omicron is changing and we have to be fluid and we have to change. So they changed it. It was a little bit after Christmas, but definitely people who are vaccinated, who are not symptomatic after 5 days, for sure, if you're, if you're vaccinated and no symptoms now, you can be back out with a mask on and go to work and be safe. If you're symptomatic, of course, it's a whole different ballgame. You still have to stay home. It doesn't matter what day it is. If you're symptomatic, do not go back into the population. Also, I think a big problem is testing out of COVID. And it's very hard for me to convince my patients that you don't test out of COVID. So the new CDC guidelines actually say do not test when you are better.
That's very interesting.
Waste of resources for us when there's a huge shortage of the tests.
So many people getting infected with the Omicron variant. Could this help build herd immunity? Is that even possible with the way the virus is evolving? I know that's something we talked about in the beginning.
I do not believe that there's going to be herd immunity. The virus keeps on changing, and I think it's just going to be something that's going to be endemic and always with us. There will not be herd immunity. It keeps on changing. We can't reach herd immunity. You see people who are vaccinated keep on getting it, so there's no herd immunity.
A new study out of the UK found that a booster shot's ability to protect you from symptomatic disease caused by the Omicron variant drops after 10 weeks. The scientists who wrote the study noted that they only studied the vaccines for protection against disease, and that protection against severe disease and hospitalization likely lasts much longer. But what does that tell you, doctor? Are we going to need another round of boosters moving forward?
I definitely believe that we're going to need boosters probably for the rest of our lives. But I also think the technology is going to improve. We're catching our tails, but they're going to have to keep up with these new mutations, and they'll probably have different types of boosters for the new variants at some point. I don't know how long that will take down the pipe. I know Moderna is definitely working on one, but it's still the most important thing is, and I keep on reminding everybody, the vaccine is meant to prevent you from dying or being hospitalized from COVID. It is not meant to prevent getting the disease, and it is working.
And hopefully they are looking for some treatments so that the people hospitalized are going to get better as well. Dr. Dyan Hes, thank you so much for joining me.